My name is Dr. Randall Barley. I'm interested in cell-based therapies, specifically to solve problems in orthopedics. One of the current problems pertains to osteochondral injuries. So if you happen to be on a motorcycle, car accident, elite sports athlete, you damage your cartilage, then ultimately your career or your quality of life is going to be impaired. Currently, the approach is to use a total knee replacement surgery for a procedure like that. And the thinking is that if you can use cell-based therapies to repair those type of cartilage injuries, then ultimately you'll get a longer lasting repair and better quality of life. From a treatment and or regulatory perspective, there's a few things that you might want to consider. The first would be the introduction of foreign DNA into patients as part of a clinical treatment. And I think we have a good example of why you'd want to look before you leap in that regard, from a case back in 2000 where a group of kids were treated for SIDS. And many of them went on to develop leukemia as a result. And that stemmed from the insertion of a promoter upstream of an oncogene. And so anytime you're putting that foreign DNA in a patient under a promoter, which will express your gene of interest at a reasonably high level, and that's usually the case, then there's always the risk. And that's certainly something that needs to be considered. The second aspect of that would be from a cell culture perspective. And I think what's important there is to realize that if you want to isolate something like microglial cells, when you take them out of the patient, you're exposing them to a range of new stimuli. And those stimuli ultimately can affect gene expression in those cells. So when it comes time to take those presumably microglial cells and re-inject them back into the patient, once you've added the plasmid to them, they may no longer be microglial cells, and who knows what the consequences of introducing cells with an aberrant gene expression could be to the surrounding tissue. And so, in a sense, if you don't kind of do your footwork or the legwork on this, you might find it's analogous to introducing a Trojan horse, and you could have a whole host of undesirable effects. Having gone through the proposal, I think it's a great idea. I think it's a sound proposal. Absolutely. I would say that in terms of cell-based research, it's absolutely the way of the future. I think over the next 2, 3, perhaps even 4 decades, cell therapy will be the way to go to address a whole host of different issues. I actually have faced some issues myself with my own research. So early on, following the BSE scare, or mad cow disease, I was acutely aware that I was using bovine serum in all of my cultures, much like most people are currently. And I realized that this was an issue that needed to be addressed because anything which is ultimately going to be used for the clinical treatment of patients should be free of things like prions. And so the only way to do that was to adopt a cell-free or a serum-free media conditions.